I'd like to begin by acknowledging that Carleton's campus is on the traditional unceded territories of the Algonquin Nation. Ottawa is home to many Indigenous peoples and communities who represent other diverse, distinct, and autonomous Indigenous nations. The Carleton community recognizes the continued responsibilities it holds as individuals and as representatives of an educational institution towards engaging in active reconciliation. Good evening, everyone. My name is Maria DeRosa, and I am the Dean of the Faculty of Science here at Carleton University. On behalf of my colleagues in the faculty, I am delighted to welcome you to the 2023 Discovery Lecture. Established in 2002, the annual Discovery Lecture provides an opportunity to showcase excellence in science journalism and is hosted jointly by the Faculty of Science and the School of Journalism and Communication. Its purpose is to showcase and promote excellence in science journalism by focusing on communicating science in a fun and interesting way. For many years, we have collaborated with Carleton's Faculty of Public Affairs, and in particular, the School of Journalism and Communication. In addition to our annual Discovery Lecture, we have partnered with the school to offer a concentration in health sciences for undergraduate journalism students, a program unlike any other in Canada. We know how important clear and impactful communication is in relaying the relevance of our research to society, and we continue to incorporate communications into our programs. For example, our unique Bachelor of Interdisciplinary Science and Practice and our certificates in Science and Policy and Science Communication enhance our students' skill set in communication and community engagement. We look forward to continuing this collaboration with the School of Journalism and Communications. The Discovery Lecture has hosted many notable speakers through the years, including Jay Ingram, Canadian author and broadcaster whom you might recognize from the Discovery Channel's popular television show, Daily Planet, and Bob MacDonald, one of Canada's best-known science journalists and the host of Quirks and Quarks on CBC Radio. Now, it's a pleasure to invite an award-winning science journalist in her own right and Carleton University's CTV Chair in Digital Science Journalism, Professor Sarah Everts, to introduce our 2023 Discovery Lecture speaker to you this evening.
Hi, thank you, Maria. I am utterly delighted to have Apoorva Mandavilli as this year's Discovery Lecturer. Apoorva started out in science, getting initially an undergraduate degree in chemistry, and then moving on to a biochemistry master's degree at the University of Wisconsin-Madison. It was thereafter that she pivoted into the world of reporting, earning a Master of Arts degree in journalism from New York University. Her writing has appeared in many places, The Atlantic, Slate, and The New Yorker online, but these days you can find it in The New York Times, where she is a staff reporter focused primarily on reporting about science and global health. And in addition to her journalism, she also co-founded The Culture Dish, which is an organization dedicated to enhancing diversity in science journalism, and was the founding chair of the Diversity Committee for the National Association of Science Writers. But among the many awards and accolades she's received, Apoorva was part of the team that won the 2021 Pulitzer Prize for Public Service for the coverage of the pandemic. And for those who are scientists in the room, that's like the Nobel Prize for journalism. I'm particularly excited to hear her thoughts on public health misinformation and disinformation based on her frontline reporting of COVID-19 and monkeypox. And in particular, she was once the former editor-in-chief of Spectrum, a news magazine about autism science. So she has a wealth of experience dealing with science and misinformation. So without further ado, Apoorva, the floor, or I guess in this case online, the mic is yours.
Thank you, Sarah, and thank you, Maria. This is my great pleasure and honor to be giving this lecture and to be counted among the journalists who have been invited to give this talk. So yes, it's been a very interesting 3 years, and I hope through this talk to give you a bit of a glimpse of what my life has been like, and also what I've learned while reporting on this pandemic, the sort of lessons in public health communication, the do's and don'ts, not just for journalists, but for public health experts, for public health agencies, and just what we can all sort of learn from this experience, because there probably will be another pandemic, hopefully not too soon. So let me begin by sharing my slides. I apologize in advance if my slideshow is not the best, because that is not my strength. Let's see. Hopefully you all see that. Okay. So unprecedented. I think I can safely say that this was an unprecedented time in reporting, not just for myself, but really for any science journalist. So I'll just walk you through quickly where I began. As Sarah said, I actually started off thinking I wanted to be a scientist. I went to school for chemistry and then biochemistry. And it was until it was my fourth year of grad school that I realized, no, this is actually not for me. I love science, but all kinds of science and not just this one single thing I'm studying, which was at the time cholesterol transport. So I left with a master's and went to NYU and trained in science journalism, unlearned some of the bad habits I had learned as a scientist, like writing and passive voice. And I ended up at BioMedNet. So I loved science and I wanted to keep writing about science, even though I was now a journalist. And so I went to this BioMedNet. It was the very first science journalism publication, really. It was before Nature News, before Science, everything. And it was for scientists, but it was a daily news site. And what I did there was I was often assigned a story at 10 or 11 in the morning. This was pre, being able to Google everybody's name. So I had to call the university hotline, ask for the scientists that I was interested in, get put through to them, ask them for their email, and then email them the PDF. And then I had to write the story and file it by 2 o'clock, and it would go up around 4. So this was the reason I'm telling you this is because I learned how to write very quickly. I learned how to report very quickly and to find the right experts to do that. And that became invaluable during the pandemic. I never forgot how to do that. And like riding a bicycle, it all came back when I needed it to. And I say that because I very quickly left reporting behind and became an editor, which, sort of happens if you are somewhat good at something, people kind of promote you. And I became sort of farther away from the reporting. I became an editor at Nature Medicine, which is a sister journal of Nature. And I built up the news section there. It was a monthly news section. I built it up from 2 pages to about 14 a month. And this is really where I fell in love with infectious diseases and public health and global health and wrote about infectious diseases as much as I could. And from there, I went to Spectrum, which is, as I mentioned, this is not my thing. Okay. Okay. Spectrum is an autism news website. It is also intended for scientists. And at the time that I started it, it was 2007. It was funded by the Simons Foundation. And at the time, it was an incredibly new model where a nonprofit was funding journalism. And I took this gamble because it was autism, it was neuroscience. It was not something that I was incredibly passionate about writing about. And I thought if it falls flat for some reason, I still have my infectious disease beat. So that's sort of what led me there. But actually, I found autism to be fascinating. And it was a time when there was so much discovered about autism. And again, writing for scientists, as I also did at Nature Medicine, editing pieces for scientists really taught me to be rigorous, to understand science, to understand the business of science, and to try and make it as accessible as possible. Because Spectrum, even though it was supposed to be for scientists, was also widely read by parents. The audience was sort of half and half. And when I started it, it was just me and some freelancers. And by the time I left, it was 12 people, and now it's 15. So I'm very proud of what it's done. We've won a lot of awards. It's a great resource for people on autism, and I'm really proud of how it's still doing, 3 years after I've left it. And so all of this led me to the New York Times. My mouse is very sensitive. I'm going to leave it alone. Which is to say, so all of these lessons, everything I learned brought me to this job. And I've said this many times, and I truly believe that everything I learned was leading me to this one point in time to sort of prepare me to report on the pandemic. So just want to give you a sort of quick, look at pandemics are not new, right? We actually always thought that there would probably be a bird flu pandemic. That's where I would have put my money. I thought that would definitely be where we would see a virus emerge. And I spent some time in China, and I thought I saw the markets where there were these chickens mingling with people. And I thought, okay, that's where it's going to come from. And then what really happened, of course, was SARS-1. And I reported on that at the time. And I just found this quote from Dr. Fauci kind of funny in retrospect, because he said at the time, we will do whatever is necessary to contain the spread of the epidemic. And now looking back, that seems so optimistic because, of course, we were not able to do everything we wanted to do to contain it. And then this is just to show you again, Spectrum is a news site for scientists. And so I went away from infectious diseases for a little bit, and I was really spending my time doing this, built up Spectrum, but then at some point, infectious diseases called me back. So I started to write for the Times. This was one of the first stories I wrote for them. Oh no, actually, it wasn't the first story I wrote for them, but it was my first front page story. And it was a big story. It was about the second person ever cured of HIV. And I wrote about leprosy, I wrote about TB, all of which are, huge scourges on the planet, even if we don't think about them very often in this, in North America. They are very much a problem in many parts of the world, and TB is still the biggest infectious disease killer. So it's a huge issue. But then came 2020 and the coronavirus. And I was really not expecting to be pulled into the New York Times COVID coverage quite as much, but I was still a freelancer, but they asked me and Carl Zimmer, who's another freelancer, to sort of be a part of the New York Times's coverage. And so I started writing about it. And before I knew it, I was writing all the time. And it became very obvious to me very quickly that I couldn't keep up my job as editor-in-chief of Spectrum and be writing for the Times at the same time. And so when they offered me a job and said, can you just do this full time? I did. It took some thinking because I was very well paid at the Simons Foundation. But it in retrospect, of course, I couldn't have made any different decision. To report on a pandemic like this is a dream for any journalist, and for somebody interested in infectious diseases, this was a opportunity of a lifetime to really be at the forefront. So here are some lessons that I learned during the pandemic, and I'll sort of talk through them. But move faster, communicate uncertainty, tell the truth, trust the public, know your role. And I'm sure for all of you, this is just, resonates already, because these are things that we've been talking about throughout this pandemic about how we can do these things better. So move faster. That one's obvious. We really did not move fast enough, especially at the beginning. So, you may remember we were already talking about this as a potential pandemic in January, but it wasn't until March that the WHO announced that it was a pandemic. There are some reasons for that, because there are trade rules that go into effect, but it still could have happened a little bit sooner than it actually did. And I think it would have helped the world take things more seriously. Another thing that really needed to move faster, and started to at some point in the pandemic, is that before the pandemic, I had this rule that I would never cover preprints, which have not gone through scientific peer review. And so there was always this sense that they're not rigorous enough. They shouldn't be, in the media, and they should, journalists should wait until finding has been thoroughly vetted by peer review and appears in a scientific journal, and then it's okay to cover it. So I had this rule, but of course, in a pandemic, who has time to wait for a paper to go through the very long process of scientific publication? Sometimes that can take 18 months. So this, so very quickly, I started to pay attention to medRxiv, bioRxiv. The Chinese researchers really began publishing stuff at the very beginning there, and then everybody else became very comfortable publishing things there. But not everyone was happy about journalists covering it. So this was a story I wrote about the B1526 variant, which was spreading in New York at the time. And so there was the city and the state had not actually told people anything about this variant, but I got my hands on two separate preprints, one of which was published before this article came out, the night before this article came out, and the other one was going to be published. And both were from really reputable teams, and both basically made the same point, which is that this variant was really spreading very quickly in New York, and it was something to take, something to look at with concern. And of course, the city was furious that we published this story, but it wasn't just the city. I don't know if you are seeing the paragraph that's highlighted, but basically we made it very clear that neither study had been vetted by peer review. We made it very clear that this is not something where, we're saying that everything is already known. This is still in progress. It hasn't been published in a scientific journal. But for us as journalists, the reason it was newsworthy was because it was something people deserved to know. This was that they should know. It was a variant that was circulating in the city and in the state, and that's something that people needed to know to protect themselves. So not every scientist was happy about this. And I got some incredibly passionate comments on Twitter and other places. And so this was one example. This was garbage reporting. People really upset with the preprints being written about before it had been fully vetted by every scientist and had been vetted even by scientific Twitter. But the interesting thing about that was that I got a lot of negative comments, but Carl, my colleague that I mentioned before, also wrote about a variant. And in his case, he wrote about a variant that was circulating in California, and his was based on no preprints and no preprints that had been published. So, but he got no flack and I did. And, I'll leave it to you to figure out why that may have happened. And of course, I was very quickly vindicated. This was just within a week. And it became obvious that this variant was something to really pay attention to. It began spreading very rapidly through the state. Fortunately, it never ended up being immune evasive or anything that was truly scary, but it certainly was contagious and it did make an impact. So communicate uncertainty. I think this is probably the hardest thing everybody had to grapple with during this pandemic. There was just so much uncertainty at every step, and everybody along the chain, public health experts, scientists, journalists, the average person, everyone struggled with this. And the way that we dealt with it at the Times was to just be really clear about what we knew and what we didn't know and what we still needed to learn. So this was the first story I wrote about the coronavirus, and it was about children. It was about how children didn't seem to be falling really seriously ill. And of course, if this was true, we wanted that information out to parents as quickly as possible, but we also didn't want to give them false assurance. So the reason we decided to go with it was because I had reported on SARS and MERS, and I knew that this was something that had been true of the other coronaviruses. And we know that in biology, things very rarely suddenly behave differently than their cousins. And so it seemed reasonable to think that SARS-CoV-2 might behave the same way, but we still were incredibly cautious. We said, why the new coronavirus mostly spares children. So far, very few young children seem to be falling ill. And also the context that this same pattern was seen with SARS and MERS. And so there were a lot of ways that we said, like, this isn't 100%, but here's what we think is happening. Sometimes, the public health agencies didn't say anything at all. And sometimes they said things with way too much certainty and did not do all of that caveating that I just mentioned. And so this was a case in which Dr. Rochelle Walensky, who was the CDC director, was on national TV and said that vaccinated people do not carry the virus. And we knew, and every respiratory biologist that I had interviewed over the previous year knew that it is possible for somebody who is vaccinated to spread the virus, and they may have symptoms, they may be able to spread it to other people. And so it was really important for us to correct the record, to sort of let people know that this is not a fully established concept. And so we wrote about this very quickly. I wrote about it the same day as soon as she did that interview. And then the CDC actually walked it back because it was, she had sort of overspoken and overstated what was true at the time. So tell the truth. This is, tell the truth is, I think, a more extreme version of what I just said, to communicate the uncertainty. And I'll explain why I think this didn't always happen, and not with any malicious intent, but there were a lot of times when the public was not told the truth. At the Times, we have, our tagline is, we tell the truth without fear or favor. That means it doesn't matter who gets angry because the coverage, we're not going to not say that. We believe that the public has a right to know the facts. This pattern started very early on. You may remember at the very beginning when everyone was saying, the public health experts were saying that we didn't need masks. And that would be true if, the virus was not airborne, the virus was not spreading without symptoms, all of those things. And yet we knew from research coming out of Asia in February, in March, even from Europe, we knew pretty early on that it did seem to be present in people without symptoms, and yet we were not talking about it very much openly at all. It took until March 31st for the CDC to say this out loud. So at this point, I had been actually reporting the story for a couple of weeks, and then Dr. Robert Redfield, who was the director of the CDC, went on National Public Radio and said something about it, and we had to rush the story out. But because I had been reporting on it for a couple of weeks, I had all of these studies that I had been looking at and all these scientists I had interviewed, and we had this fully reported story ready to go about how, people without symptoms can spread the virus. And this was one of the most widely read stories because it was news to people, because nobody had been talking about it yet at that time. And then the day after this, the CDC did recommend masks for everybody. This is actually from something that happened, I think, as late as June or perhaps July. In a press conference, a scientist at the WHO said that transmission of the coronavirus by people without symptoms is very rare. And by that point, the estimates were, possibly as high as 50%. Nobody knew yet quite what it was, but it seemed like it was a significant proportion. So for the WHO to say it's very rare was just really unfathomable. And they got a lot of pushback from scientists. We wrote about it, and then they sort of walked it back and said it was a misunderstanding. There was a lot of this sort of giving people information and giving people half information or milder information. And the explanation was often that they didn't want to panic people, which I'll say more about in a little bit, why that doesn't always work. And sometimes the press was tasked with correcting outright lies, not just, not telling the full truth so as not to scare people, but actually just misinformation, in this case, created by the government. I think that's definitely a first for me, to be really actively looking at things coming out of the CDC and seeing if they were manipulated. And this is a story that I wrote because there was a guidance that came out in August saying that people who didn't have symptoms didn't need to get tested. And that was just so against everything we knew at the time, so against scientific information, that it was obvious to everybody who knew better that the CDC could not possibly have published this on its own, that the CDC scientists probably were not behind this. And true enough, what my reporting showed is that it was Brett Giroir, who was at the time the Deputy Assistant of Health and Human Services, who wrote it. He was a member of the Trump administration. He essentially wrote the guidance, and it was just published on the CDC website without approval from CDC scientists. And I had emails that I had acquired where basically CDC scientists said, this is wrong, we can't put this up there. And they were told, you don't have the capacity to edit this. You're not allowed to edit this. There were other such bizarre things that went on, like in this case where there was an acknowledgement very briefly that the virus spreads through the air, and then it vanished the very next day. And to this day, you won't find the word airborne connected with the virus on the CDC website or the WHO, because they don't really want to say that word, and because it implies then that there are a lot of precautions that hospitals have to put into place, that all healthcare workers should be wearing respirators. It involves a lot of really high level of controls. And so they really didn't want to say this. And sometimes that meant also upsetting scientists and universities, telling the truth. It doesn't matter who you're telling the truth about. Somebody's always going to get angry if you tell the truth. And so in this case, it was soon after the vaccines were rolled out, we started to see that NYU and Columbia, and there were a bunch of other universities across the country, were having all of their graduate students be vaccinated, even though the rules said it was for patient-facing people. There were all kinds of students getting vaccinated who had nothing at all to do with patients and never came into contact with them. And this story did not make those universities very happy. To my mind, this is one of the most egregious examples of where we were not told the truth for our own good. This is a case where the CDC was not really identifying how many breakthrough infections there were. We're not really talking about it. And so I went to every single state database that I could find. It was very hard to compare them because they all have different ways of collecting data, different ways of publishing the data, different ways of classifying them. So I was only able to get information from a few states. I think it was 7 states. And I looked at all of the data, and the data from those 7 states was enough to be able to see that, in fact, there were vaccinated people in hospitals. There were vaccinated people among the dead. They weren't huge numbers, but it was happening, and that we needed to really be paying attention to that. So that was it came a few weeks before the CDC acknowledged it publicly. Trust the public. So it all comes down to this. I think a lot of the reasons that the information was withheld at times was because people thought, those in power thought that the public couldn't handle the truth, that they didn't understand nuance, that they would get confused, that they wouldn't understand what to do. And so they wanted to keep everything simple. And in wanting to keep the message simple, they left out a lot of nuance and sometimes just wholesale information because they didn't want to worry anyone. So, you know, the US and the world was getting a crash course in uncertainty. And one of the reasons I wrote this piece, which was really a news analysis, was that I saw that consistently people were blaming the public for not, you know, understanding. The reason we're saying things in this way is because you don't understand this, because they don't, you know, people aren't educated, people don't understand. And as somebody who communicates for a living, it felt to me like that was not enough of a reason, that there really needed to be more effort to explaining things properly rather than just saying people don't understand, so we just won't give them this information. There's an entire field of health communication that is basically tasked with doing this. How exactly do you convey information in a way that is clear and simple and yet doesn't leave nuance behind? And I just want to give you a few examples of stories that I wrote during the pandemic that I think really illustrate that the people wanted information. So this was about cytokine storms, which is a really complex immune phenomenon. I wrote the story very early on. I think it was probably March or April. And then this was a story about PCR tests. Now you all know what PCR tests are, but this was about a metric called cycle threshold value from a PCR test, and the fact that those sometimes are picking up virus that is dead and can pick up an infection long after it's not a threat anymore, that it's, you know, it's picking up sort of remnants of the virus and an infection that was true but isn't anymore. And so this was one of the widest read stories I think that I wrote, and it was about a very obscure metric in laboratory biology. And then this was a story about how you shouldn't worry about all this stuff you're hearing about your antibodies waning, because that is actually what is supposed to happen with any infection. Imagine if you had all the antibodies from every infection, your blood would basically be sludge. And so it's natural and normal for antibody levels to come down after the initial infection or vaccination. So I'm not minimizing the very complex task in front of public health agencies and in front of everybody else. It was very difficult to figure out how to communicate, what to communicate, when to communicate it, how much nuance to give, and of course they were in an impossible position in many ways. If they gave too much information, you're confusing everybody. If they didn't give enough, it's you're hiding data. So I understand how difficult things must have been for them, but I think there were probably opportunities missed where they could have said the science is incomplete. This is our best advice for now, and it will probably change. And in trying to reassure people, they projected certainty that did not exist. And I want to give you a sort of example, a deeper example of this and the really life and death repercussions it can have from the World Health Organization. So I was reporting the story for many, many, many weeks. If you know the WHO at all, it's that, it's very powerful, and people who work for it really just never want to upset the powers that be, because then they would never work in global health again. And so it took a long time to report the story because it had to be done, a lot of it on background with people who didn't want to be named. But essentially what I found is that in the course of reporting the story is that there were just a few people, maybe just 2 or 3 people on the Infection and Prevention Control Committee at the WHO that believed that hand hygiene was really very important, and that people couldn't handle being told to both wash their hands and wear masks. And so they went with wash your hands. And that's why they didn't say that people needed to wear masks. So there was a group of 239 scientists who were calling on the WHO to say, look, you have to acknowledge that this virus is airborne. This is really important. And this was coming out on sometime in July. I had an early copy of that, but I also had all this reporting of what had happened behind the scenes. I had, internal emails and recordings of calls between some of the people on the committee. And so I had a good picture of where this decision was coming from, and that it wasn't this consensus. It was actually being led by just a few very loud people, and everybody else who actually did think that it was airborne was being shouted down. So this story came out on July 4th, and I thought, oh, no one's going to read this because it's the 4th of July. And it was a Saturday, and yet it went just bananas because again, this was information that people really, really wanted and needed to protect themselves. And so the story came out on the 4th of July. On the 7th, the WHO, after there were some news reports from the AP and Reuters and other places saying, what are you going to do about this New York Times article? They said, we are going to review this evidence. We actually have always meant to review this evidence. And then on July 9th, they acknowledged that the virus is airborne. So this, if you ask me one thing that I'm really proud of during the pandemic, this would probably be it, because as you may know, there are many countries that fully rely on the WHO for guidance, and for them to not know that they needed masks to protect themselves until July, I really don't want to think about how many lives may have been lost because of that. And this kept happening. This was in January 2021, after the vaccines came out. There was just very limited data on how pregnant women were, how they would do with the vaccine, and whether it was safe for them. And the WHO and the CDC looked at exactly the same data. The CDC said, consult with your provider. And the WHO said, we don't recommend the vaccine at this time. And what they meant was that they didn't think that it was unsafe necessarily, but they just didn't also think that there was enough evidence to say it is safe. But in sort of trying to be very careful with their language, they actually ended up indicating in some way that the vaccine was unsafe. And so we wrote the story on the 28th, and then on the 29th, they changed the language and made it more clear that actually no pregnant women can receive the vaccine safely. And in case you think I'm being too hard on the public health agencies, here's an example from last year, February. This was a story that I reported that I found flabbergasting as I was reporting it. The CDC had access to information about who was in the hospital at any given time by age, race, sex, vaccination status, and they did not publish any of it because, in their own words, and I have them quoted in the story saying that they were worried that anti-vaxxers would misuse that information. But this information was incredibly important to decide who should get boosters, when they should get boosters. And instead of relying on data from the United States, we were relying on data from Israel, which is a country of 9 million people and completely different in demographics. And the CDC's own advisors and the FDA's advisors didn't even know this data existed. So that's a level of trying to protect people by not giving them full data that I think is, as many experts put it to me, unacceptable. So know your role. This, I just want to say that at many times in the pandemic, there was some confusion about why I was writing stories like this. I would get a lot of email from people saying, you are undermining public health. You are making people lose faith in the CDC. How do you sleep at night? Things like that. And this is one example of a story that I wrote in September 2021, by which time there were a lot of studies coming out suggesting that maybe Moderna's effect lasts a little bit longer. And so we said right there in the headline, they're both knockouts, but one seems to have the edge. And yet I got emails from scientists who said that I was promoting anti-vax, that I was undermining the vaccines, and that people wouldn't take the vaccines because of the story. If you recall, at the very beginning of the pandemic, we were told, when the vaccines first came out, we were told over and over, all the vaccines are the same. Take any of them, they're all protective. Well, the second part is true. They were all protective and they were all pretty great, but they were not all the same. And I think the public deserved to know that. And the reason I say that is because the public health experts who are writing to me, their job is to promote public health. My job as a journalist is not to promote public health. It's to give people information so they can make the right choices about their health. But my job is not to make them take the vaccine regardless of what the evidence shows. So that I think is a very important distinction, and one that sometimes was lost on some of the experts out there. Another example of this is a much more recent is, will COVID boosters prevent another wave? And I wrote some articles that were pretty skeptical of this, and I think was vindicated later on when they changed the overall recommendation to really be for older people, because it wasn't clear that it was going to be all that much beneficial to younger people or that it would prevent transmission. And again, not my job to get people to take the boosters. It's my job to give people information on where the scientific evidence, or at least the bulk of the scientific evidence, lies so that they can make their own decisions. This is all stuff that we need to learn, and we need to learn it very quickly, and we need to learn it as, in as much clarity as possible, how to convey these messages. how to convey them with nuance and not just withhold information. This is, monkeypox, right? Coming off of COVID, immediately monkeypox started, and it was very different than the monkeypox that people had seen before, and they really were taken aback by it. And it took quite a while, once again, for things to get off the ground. Happily, not quite as long, and the outbreak did come under control a little bit sooner. But it's just to say that these viruses will keep coming, and we're not always going to know what they do. In the case of monkeypox, we actually had a drug and a vaccine and all of these things, but there wasn't enough of the vaccine, and the drug was incredibly difficult to get because, at least in the US, public health and medicine are very separate, and the guidance from the rules for doctors to be able to get the drug were just impossible for most doctors to navigate, and they were being set by public health agencies. And then last fall, polio was a threat, and it came back in London, it came back in New York, fortunately not at any significant levels, but just enough to say, look, polio is not a completely gone threat. It's not eradicated. And if the vaccination rates plummet below a certain level, it could come back even in places where it hasn't really been a threat for many, many years. And then most recently, this was just from last week, bird flu, which I think sort of brings it full circle to where I began in 2005, worrying about bird flu being our pandemic. And I'm just not sure that we are actually ready for any of those things. This is a story I wrote last fall, and it was quite depressing because essentially what it said was that there are many, many structural problems, and communication is the one that I've talked about the most here, but there are many structural problems that make it very difficult for a country like the United States to respond quickly to a pandemic. And unless we figure that out before the next one, I'm not sure that we'll do any better. So I'll stop there and I'll open to questions.
Thank you. Thank you so much, Apoorva. That was really fascinating. For everybody in the audience, if you have a question, please put it in the question area. I'll start monitoring it, but I have a couple of questions myself that I'm going to use to seed. So you just really took us through the ball after ball that was dropped by public health communicators. Do you feel like they have gotten smarter? Do you feel like they've learned lessons? Or are we going to see the same thing the next big pandemic that comes out? What are your thoughts on that?
I think, as I said at the end, with the structural issues, there are a lot of things that I'm not sure we'll do any better with, because they really haven't done a great job of figuring out how to sort of bring together medicine and public health, for example, and to come up with guidance that works for the way that medicine is actually practiced. But there are some positive signs. I mean, I think in monkeypox, one thing that I saw was, in COVID, we left the communities of color behind. We left some of the most high-risk people hanging and didn't really take care of them. And took a very long time to even acknowledge that as a problem. But with monkeypox, the acknowledgement came much sooner. And even though at first the vaccination rates were much higher among white men, they did make an effort to go to Black Pride events and community organizations, and they reached out through community leaders, and they did things that they needed to do to reach the right people. And, the rates are still not the same, but they at least had thought about it and had really come up with some very smart solutions. And the other thing that happened with monkeypox is that the CDC talked about sex very openly. They talked about safe sex and neutral masturbation and things like that, and didn't, sort of tiptoe around things that needed to be said. And that was in great part due to one particular CDC official who spent a lot of time in New York City and had done this kind of work before on HIV, but it really did make a huge difference to be able to do that. So I'm hopeful that, at least in the US, that some of these lessons have been learned. And I think as a world, we have learned a lot of lessons, but in order to put the solutions into practice, we need money, we need political will, and we need people to take it seriously. And I'm not sure any of those three are in place. I think the experts and the agencies are ready to go, but where's the money? The US at least has not funded pandemic preparedness anywhere near where it was asked for by the Biden administration. Who knows what will happen with the next administration? And I think mostly it'll be people who don't want to take a pandemic very seriously anymore. People are tired and want to move on.
I was really fascinated by the ways that you pointed out that public health really made some missteps, but I'm also curious about your thoughts on misinformation writ large during the pandemic, which we just saw skyrocket. And as a journalist, how do you make the decision to report a debunking story? Because there's always the concern that by debunking something, you're effectively going to share it more broadly, right? So yeah, can you tell me about like your thought processes as you decide whether to do that, to report a story that says, okay, this is total hogwash, and how you approach the actual reporting?
Mm-hmm. So when there is that kind of misinformation out there and we have to figure out exactly when and how to report it, timing, I think is really, really key. So I didn't always report on misinformation myself directly because I was writing a lot more about the science most of the time. But as you saw, there was sometimes misinformation coming out from the administration, and that had to be corrected very quickly and very clearly so that people knew how much of it was true, if any, and where they should, stop listening to the administration. In terms of sort of misinformation that goes around on social media, I think we really, really missed the boat on getting to some of the misinformation before it began, and it should have been obvious that it was heading this way. You mentioned, that I started Spectrum, and I certainly knew exactly how powerful, how well organized the anti-vax community is. And it really took me by surprise that there was not a very concerted effort to get all of the information about the vaccines out well before they were rolled out, because we knew the vaccines were coming and we could have been ready. And actually, I recently asked Francis Collins, who's the director of the National Institutes of Health here, whether he thinks we did enough. And he said, he acknowledged that we really, the NIH should have done more, the scientists should have done more. They didn't do enough. So when we see a situation like that, where we see sort of misinformation catching fire, it is, as you said, important not to give oxygen to it. So you want to sort of write the story when it's making the rounds enough that you feel you need to address it, but yet not so late that nothing you say is going to matter. And I think the vaccine stuff, in terms of the public health approach, was too late along those lines. I did some reporting in Rhode Island in January or December 2020, and it was already too late then, before the vaccines were even reaching some of the immigrant communities where I was reporting. And so that the timing is everything. And then the message has to be simple enough. One of the reasons I think misinformation really succeeds is because there's a very simple message. It's the vaccines are going to cause infertility, and the best way to counter something like that is with an equally clear and simple message. And so we have a desk at the New York Times where reporters were actively monitoring social media for misinformation and then writing these incredibly wonderful articles with very clear headlines. Like the headline would say, "No, the Pfizer vaccine does not cause infertility." Like, let's not beat around the bush here and get right to the point. So I think that's very important. And then another thing I learned from my colleagues is that when you are looking at something on social media, if you don't want to amplify the wrong thing on social media, even if you are commenting on it to say this is wrong, just by tweeting about it or sharing it on Facebook, even if you're saying, "Oh, look at this thing, this is not true," it can easily be manipulated to make it seem like you are. And so when you share something like that, what I learned is that you should put a big red line across the picture so that it's very obvious that what you're saying is, this is not good, not true, exactly, to make it very obvious. So those are some things that I've learned along the way. And then how do I make sure that I get the right information? It's all about the sources. I love my sources.
I'm going to get to the questions in just 1 second. I just have one more question. You said prior to the pandemic, you had a rule, never report on preprints. Is the cat out of the bag? Like, are you ever going to go back to that rule? Do you have any thoughts? How do you approach reporting on preprints?
Yeah, I'm probably never going to go back 100% to that. But what I will say is that the bar has gone back up by a lot. So now I still look at the preprints. I still get an email every day from bioRxiv and medRxiv, which are the two big preprint servers. And I look through those every single night to see if anything big is happening, any trends that I can see. But it would take a really important finding from a really reputable lab that also made biological sense for me to wander into it. If something seems outlandish, something seems coming from a place that I've never seen, publish anything on that subject, then I probably would wait for the dust to settle a little bit. And when I do report on those things, one of the things that surprised me about the really strong reaction against preprints is that peer review is not infallible. Peer review essentially has, 3, maybe 4 experts looking at it, and maybe this is just experiments. They really go through the data carefully. But I was doing a simplified version of that myself. Every time I would look at a preprint that I thought was perhaps newsworthy, I would send it to a few sources that I trusted and ask, what do you think about this? Is this worth covering? Do you think it's sketchy? And then if they said, no, I think this looks solid, it's important, then I would really start to report it. I would send it to more people, really talk it through, figure out what the flaws are, and present all the flaws. So it's not as if, we saw preprints and then just sort of wholesale bought the message with no commentary and no context.
We have a question that kind of jumps off from that idea. How much have you used Twitter and other social media to get leads on important stories, even faster than preprints?
Not so much now. I really actually spend very little time on Twitter now because it's become way too toxic for me. So I tend to not really go there that much. But in the beginning of the pandemic, a lot, because even before preprints were coming out, I used to go to a lot of these smaller conferences, Gordon conferences, Keystone conferences, there where scientists talk to each other, and you can listen in on the sort of debates, and you can see people, asking questions, and all of that was happening on Twitter. So it was super important for me to be hanging out there. And it was like they were all having this conversation very publicly, which, as we know now, also was bad because there were a lot of people in the general public who were listening and taking the wrong message away from it. But for me as a journalist, it was a great way to figure out where, what was known, what was important, what was good, what was causing consternation. And often, scientists would bring things up like, I've been hearing about XYZ, and this reminds me of this other thing. And I'd be off to the races with that story, trying to figure out what was going on there.
Interesting. Is there a way or any way to ever resolve the conflict in the different interests between scientists, elected officials, and journalists? Like, as you were talking about the issue with public health communicators, it reminded me a lot of, the war in Iraq when, the media was like told to get on side with the voice of authority. Do you have any sort of thoughts about that parallel and also just like that conflict?
Yeah. I think it's actually a good parallel because, I actually just received an email today from a scientist saying, can we work together to spread the message about X? And I said, I don't work together with scientists. I write about science, and I hold science and scientists accountable. So I think that's a distinction that's very important. Just like war correspondents might write about the national security issues and might sometimes write about things that the government doesn't want written about, journalists sometimes are going to have to write about things that scientists don't want written about, as I had to during the pandemic. And I think that's a healthy tension. There are, most of the time in normal times, I think everybody's on the same side, and the conflict doesn't exist in quite such a stark way. But unless there's sort of misconduct or, malfeasance of some sort, generally speaking, everybody's on the same side. But when it comes to this kind of situation, or, in situations where there is that tension, I think that's healthy. You want the press to be skeptical of science and of scientists and of public health agencies. If everybody was on the same side and they were all sort of in cahoots giving the same message, that is actually a disservice to the public.
Do you find it is sometimes hard to get scientists to speak when they are going against that party line? And we're not talking, rando people who are conspiracy theorists, but, people who are doing legit science. Can you speak a little bit on that?
Yeah, so I'm actually writing a story right now, and I don't want to talk too much about what it's about. Like a journalist, I'm a little wary of that, but I will say it's a kind of an explosive topic, and I have run into so much resistance from I'll just say it's about vaccines, broadly speaking, and there's so much concern about the anti-vax movement that there are a lot of experts who don't want to talk about it at all, who don't want to even, even broach the subject, and they get very, very anxious and they want to stop the conversation. They don't want to be associated with any sort of anti-vax sentiment. They don't want the attention. I reached out to a big hospital here, a very big hospital system, in fact, hospital system, and asked them for access to one of their experts. And they said no, because they didn't want that attention. They didn't want that spotlight on them, or have any of the comments that were made be manipulated by anti-vaxxers, for example. And so there is this like fear of wandering into controversial topics. I think, scientists are very cautious people.
That's interesting. There's a question that kind of alludes to that too. It's in regards to the core values of journalism, curiosity being one of the major ones, and also controversial topics, masking, lockdowns, the origin story of COVID-19. How do you see journalism writ large performing and investigating these issues? Presenting some as conspiracy theories and then now not, or can you kind of talk a little bit about how journalism writ large is done on that topic?
Yeah, I mean, what we can do is follow the evidence, right? At the time that the evidence says point in a certain direction, you can sort of interrogate it and say, is this really holding up? So with masks, I think like most other science journalists, I started out trusting what I was hearing from the government, because I had very little reason to believe that information was actively being withheld. But as soon as it became obvious, I talked to a lot of researchers in Asia, and as soon as it became obvious that there was actually reason to believe that there was asymptomatic spread and masks were needed and all of that, and also that, the virus was spreading actually most effectively 2 days before the symptoms appeared, when that information was coming out, it sort of clicked that, okay, no, we're actually not being given the truth, and this is something I should be digging into. So, it's not always obvious right away where to look. I don't write about all aspects of COVID. I don't write about the origins, for example, so I don't have a stake in that. But I think when there is something that I am paying attention to, that I think it's my job to bring the truth to people, I am now at a point now where I question everything that everybody tells me, and it's maybe an unhealthy level of skepticism, but it's served me well so far in this pandemic, and I'll probably hold on to it a little bit longer.
Interesting. We have a question about reforms, actually. Can you envision any useful reforms to the way academic research is organized or funded, at least in the US, that would improve your ability to report in the future? Is there kind of structural things that could help?
Yeah, I think the entire tenure system is really messed up, and it incentivizes scientists to be secretive, to prioritize publication way too much. Before the pandemic, the timing of results being actually published was so ridiculous, because no one wanted to talk about their results until the paper appeared. So everyone was afraid of being scooped, because everyone wants the paper in Cell, Science, Nature. They're one of the big journals, and I think that incentive system just hasn't really been a disservice to the pace of information and the process of informing the public. When you go to a scientific conference, you're actually, unless they make an explicit rule that the press can't report on anything and make you sign stuff, in which case I probably wouldn't go to that conference. You're allowed to report on things, but sometimes we would report on things that people were presenting at a conference, and they would get very, very angry. And I wanted to always say, why exactly are you talking about this then? It's not, if it's good enough for you to talk about at this conference, which is pretty public and the abstracts are online, then it should actually be better for a journalist to write about it and talk to experts who can put it into context than have some random person come across the abstract online and draw their own conclusions and then spread that. So I think that the incentive system is a big one. And in general, I think scientists are too nervous about talking. And one trend that I have observed, which I think is extremely unfortunate, is that every institution now has a very, very active press team. And while I see their value sometimes, and I do work with some press people, the press information officers at institutions that are helpful, it's often has a chilling effect. People don't want to, talk to a journalist freely when they're worried that they're going to be overheard and they might get into trouble if we're saying something wrong. And even if they're not saying anything controversial, just the presence of that person has an effect. And I'm really not happy when, you know, they want to sit in on the interview, and their reason is always, I'm just trying to learn what you're interested in. And I always want to say, well, I'll tell you what I'm interested in. I'm interested in talking to that person alone. But yeah, that is a trend that I don't at all like, and I try to fight it as much as I can.
Right. Well, I mean, the comms person is, their job is to promote the branding of the institution. Their job is not science communication.
Exactly. Yeah, inherent conflict of interest there.
Yeah. Yeah. Speaking of like forward-looking questions, do you have any thoughts about how ChatGPT, this is a hot topic right now, how that will impact science writ large, or perhaps science journalism, or perhaps science communication? Do you have any thoughts?
Yeah, I mean, I might be wrong about all of this because I really know very little about where this is all headed. I think none of us do, except maybe some very, very few AI experts. I certainly think it's going to change things very quickly in scientific publishing, because we've already seen examples where, you know, chatbots have written entire papers and no one has detected it. So I think that we'll all have to be more careful of. Journal editors will have to be more careful of. Scientific journalists, you know, have to be more careful of, to figure out where this paper actually come from. Hopefully all the journalists who write about things like that are actually reaching out to the people who supposedly did the work and making sure that it's a legitimate paper. But in this era, when, you know, a lot of publications have gotten rid of science journalists, and science is often written by people who don't know that much about science, you know, sometimes sports reporters or something entirely different, because it's a very small staff, they may not have the time or the wherewithal or knowledge to call the right people. And so that does give me a lot of anxiety to think about what might happen there. Will it replace science journalism, as, you know, you and I are talking about it, written by science journalists? I don't think so, because I think so much of what we do is not just, you know, putting together pat statements, but sort of really adding context and adding caveats and things like that. And while I have seen some incredibly scary things from ChatGPT that seem like they were written by someone, you know, very smart and who had done a lot of research on something, I'm hopeful that they can't completely replace the sort of analysis that a human would bring to something.
We also have a question from the audience. Are you afraid that we as a collective will forget what we felt and learned during at least the early days of the pandemic? What it taught us about communicating, hand hygiene, even just being considerate of others. Yeah, do you have any thoughts about that?
I mean, I think that ship has long sailed.
Okay.
I think, you know, I'm not just worried that we might forget. I think we've already forgotten. I think the majority of people have already forgotten everything they felt at the beginning of the pandemic. And a lot of people who knew what it was to feel fear, knew what it was to be considerate of other people, to worry about the community and not just themselves, to want to protect, you know, the people, the older people and the high risk people in the community, and perhaps kids, you know, in the case of other diseases. That I think has already gone back to normal. And if anything, we seem to have lost some humanity along the way, to where, you know, if you do wear a mask now, people get attacked or they get sort of laughed at. And there's like the pendulum has swung in the opposite direction, where taking something seriously or worrying about other people is now considered, you know, foolish or gullible. So yeah, and unfortunately, I think we've really forgotten already and want to forget to some extent.
Yeah. We have a question. A major part of pandemic policy and discussion has been based on simulation modeling, so computer models. But these models are, you know, often really complex and often really opaque to anybody who's not the modeler themselves. I mean, this kind of alludes to the ChatGPT in a way,
Yeah.
but especially not to the general public. How do you deal with modeling results as a science journalist?
I very, very rarely write about models, especially during the pandemic, the models that sort of predicted how many deaths there would be or how many cases there would be. I mean, I think it's just such a foolish exercise. You know, it's really just prone to so much error, garbage in, garbage out. If you don't have the information to really make smart predictions, you're going to get predictions out that really make no sense at all. And there were a lot of predictions that were way, way, way off, because this virus was not as easy to understand as we thought it was going to be. And so we actually really stayed away from them. Early days, we did do some modeling. I myself didn't write about it that much, but there were people who did it. And our data team worked with some very smart modelers like Jeffrey Shaman at Columbia to chart things and see where things, if everything goes this way, where is it headed? And they were very careful about saying things like that. Like if all these things go, and some of them were interactive, so you could play with it and you could see, but if the numbers go down to this, what will happen? If the R naught becomes this, what will happen? And so it was not modeling, just saying like, oh, this many people are going to die, but being very careful to sort of allow people to play with all the variables and see what all the different outcomes could be. And I think that was a smart and useful way to do things. But I agree with whoever said it's very difficult. So much depends on all the assumptions they make and whether they made the right assumptions for the right variables, and it's just too complicated.
We have another question. What do you make of the rise of independent media becoming a big source for news on pandemics, COVID-19, health writ large? Do you write that off as part of consequences of misinformation, or do you think traditional news sources have failed people, or what do you see on that landscape?
Well, I don't know what they mean by independent news sites. I mean, hopefully every news site is independent of some kind of interference. The traditional media may have publishers, but they're still connected in some way. I mean, independent media, I guess if you mean sort of alternative media that has come up just recently or is run on a shoestring budget, or I think everything has its place as long as it's done rigorously. If it's reported well, if it's fair and accurate and actually takes the time to vet the information and doesn't just regurgitate what it's seen in 18 other places, then absolutely it has a place. But if it exists only for shock value or clicks, then no, it doesn't belong as journalism, and it doesn't it's not providing a service, and it's probably actually extremely harmful.
Well, we've come to the end of our time today. I just really appreciate you being here and you sharing your insights. Is there anything, like a good journalist, I'm asking that question we always ask, is there anything you wanted to add or you thought that you would be asked but weren't?
No, there isn't. I think we've covered a lot of ground. We've covered the entire 3 years. And you've asked all the questions that, all the stuff I didn't get to in the talk. So I appreciate that. And this was really a pleasure.
Thank you.
Amazing. That was fantastic. So let me be the next to thank you so much, Ms. Mandavilli, for delivering such a really, sobering but insightful talk for our 2023 Discovery Lecture. It was really fascinating to hear your perspective, and you've given us a lot to think about. I didn't expect to be thinking about tenure as part of this. So that's really great and exciting for me. Thanks so much for that. And also thank you, Professor Everts, for all your effort in bringing this annual event to life. Thank you both. And to all our audience, we appreciate you joining us virtually tonight. Before you sign off, there's a few events that I'd love to alert you to, which are free and open to the public. The first is Data Day 9.0, a full day conference that explores the latest developments in big data, artificial intelligence, and machine learning. We heard about ChatGPT at this talk. Maybe there'll be something there about that. This year's theme is the data-driven economy, and we'll be discussing disruptive AI and its economic impact, among many other interesting topics. That's on March 28th. I also want to mention Life Sciences Day 6.0 is coming up on May 25th. Registration will be open in early April, and this year's event will focus on the topic of talent development for an evolving life sciences sector. Both events offer networking opportunities, will showcase work done by our graduate students, so please, don't miss it. And not only that, the Faculty of Science is celebrating its 60th anniversary this year. We will be hosting a variety of events to celebrate this milestone. Further details will be shared in the coming months. You can visit our website, carleton.ca/science, for more information and registration details for Data Day and the other upcoming events. And please follow us on Twitter and Instagram at Carleton Science. Share your thoughts about tonight's lecture using hashtag Carleton Science. We always enjoy reading posts from our community on social media. Thank you very much, everyone, for attending our 2023 Discovery Lecture. Have an amazing evening.